Your staff asked that we focus on some improvements that can be made on employer-based health coverage, and predominantly that's what my testimony will focus on. I will be happy during the question and answer period to take up the challenge that you raised in the beginning about what are the different ingredients that can get us to universal coverage. We believe that employer-based coverage can work together with public program coverage to create a uniquely American hybrid private-public approach to achieving the goal of quality, affordable coverage for all. This hybrid approach would strengthen employer-based health coverage by improving regulation of the market, subsidize private coverage for many workers with moderate incomes, and expand public safety net programs like Medicaid to fill in gaps for low-income people whose needs are often not met by the employer-based system. Employer-based coverage does provide critically important protections to consumers. It is guaranteed, that is, people will not be denied coverage based on their health. Under current law, insurers are limited in their ability to exclude coverage of pre-existing conditions, and employees within a group cannot be charged higher premiums based on their age, health status, or gender. Further, large employers are generally able to negotiate for good, comprehensive coverage for their employees. However, there is room to improve our employer-based system from a consumer perspective. First, under current law, insurers can exclude coverage for pre-existing conditions for up to 1 year for employees who previously had less than 12 months of continuous coverage. These exclusions cause employees to postpone or forego treatment for serious illnesses such as cancer. This law should be amended so that people have protections against pre-existing conditions when they first become employed and buy coverage. Therefore, we at Families USA support the Pre-Existing Condition Patient Protection Act of 2009, introduced by Congressman Courtney, which would amend ERISA to entirely prohibit pre-existing condition exclusions in employer-based plans. Second, under current law in 40 states, insurers can charge small employers higher premiums if the employees as a group are in poorer health and or because they have a higher proportion of women employees. This means that small businesses with higher numbers of people with health care needs or with higher numbers of women face unfair higher health insurance costs. Therefore, Families USA recommends that Congress improve employer-based coverage for all workers by banning health status and gender rating nationally. Insurers should charge all businesses buying the same plan the same price. Third, more must be done to address affordability. This will require that both low and moderate income individuals receive premium subsidies that put their share of the cost of coverage within the family's financial reach. These subsidies should be larger for those with lower incomes who are the least able to afford coverage. Further, these premium subsidies should be accompanied by appropriate out-of-pocket cost protections, deductibles, co-payments, limits on total coverage, and uncovered benefits. One key way to protect consumers from unaffordable high out-of-pocket costs is to make sure they can buy a comprehensive benefits package that covers the full range of health care services that people need. I should note that a comprehensive benefits package must have reasonable annual and lifetime caps on the total dollar amount of health care services that will be covered. In 2007, 22% of workers had caps from $1 million to $2 million, and some workers had caps as outrageously low as $250,000, a cap that would preclude coverage for typical cancer treatment. Therefore, Families USA recommends passage of legislation such as the Health Insurance Coverage Protection Act, H.R. 1085, co-sponsored by Congressman Kildee, that will increase the lifetime caps to $10 million in employer-based coverage for employers with 20 or more employees. I notice my time is up, so I will stop there and happy to respond to questions.
Thank you.